the quality care you need in your neighborhood. Welcome to Weill Cornell Medicine in Long Island City. Our newly expanded practice in Long Island City is a partnership between Weill Cornell Medicine and New York Presbyterian. We are excited to provide the vibrant Queens community with the world-renowned multidisciplinary care that you expect from our team of compassionate expert physicians. In addition to primary care, our practice has grown to include specialists in obstetrics and gynecology, orthopedics, imaging, and other services to care for you throughout life's journey. It's our goal to collaborate with our patients to achieve optimal health for you and your loved ones. With access to Weill Cornell Medicine and New York Presbyterian's full network of physicians and specialists, care is tailored to provide the best possible outcome for our patients. To accommodate our busy patients and families, we offer extended hours and same-day appointments with in-person and virtual options. Our Long Island City office is conveniently located near subway and bus lines, making it accessible to residents across the neighborhood. Located at 2825 Jackson Avenue in Long Island City, our world-renowned physician team is ready to care for you and your family. Call to make an appointment, 646-962-9921.
Very exciting to see this facility for this community. We have specialties such as family medicine, pediatrics, internal medicine, obstetrics, gynecology, orthopedics, radiology. We have needed this kind of access to world-class healthcare and such a state-of-the-art facility.
Patients see a number of specialists regarding whether they're healthy or if they have legitimate medical conditions. I always want to be the person that the parents feel comfortable coming to if there's an issue.
It's meaningful to me to foster long-term, lasting relationships. I enjoy knowing patients over the years and getting to know their families.
At the end of the day, medicine needs to be patient-centered and according to a patient's own goal. We really ought to be in pursuit of whatever gives patients meaning in their life.
Weill Cornell Medicine and New York Presbyterian truly is an academic, evidence-based center that really cares about a patient-centered approach. I believe that you're in good hands here.
This was always my dream job. I always wanted to work with kids and I always wanted to be in medicine. I feel very lucky and grateful to be in the position that I am, to be working with such a wonderful staff and such a beautiful location with the amazing patients that I get to work with. I chose Weill Cornell Medicine because it is a collaborative environment that is world-renowned. From our front desk staff to our nurses, to our doctors, everyone that you're gonna encounter during your visit, they all are experts in taking care of children and making sure that they feel as comfortable as possible, even when they're not feeling so well. In primary care pediatrics, I focus on preventative health, counseling, acute medical concerns, and chronic conditions as well. During wellness visits, we always monitor growth and development. We also do screening blood work if need be, and we also do vaccinations as well. For any acute or sick visits, those issues can range from an acute asthma exacerbation or an ear infection or a regular upper respiratory infection. We counsel parents through the different stages of life, from sleeping to potty training to how to introduce solid foods. When kids get a little bit older, around school age, we focus a lot more on schooling specifically and problems related to schooling. Then when kids get older, we focus on screening for any mental health concerns and also counsel our teenagers on different life stressors, whether that's choosing the right high school or college or managing any family stressors that they might be facing as well. It is truly a privilege to be a part of such pivotal moments in our patients' lives, and it's really great to see that when we really work hard on building a foundation for healthy lifestyle habits, it's great to be able to witness those evolve and remain throughout their lifespan. I continue to be passionate about my work because of the patients that I work with and the families that I get to speak with on a daily basis. I love my job. I love talking to the children and watching them grow. So I'm most excited to see this process with my own eyes and support families through the transitions of life.
The most appealing thing about working at Weill Cornell Medicine is actually being supported by every single person who's working here. They all have one mission, and that's to provide outstanding care to our patients. Everyone makes sure that the patient feels comfortable and is safe, and also is understanding of what's going on in the process. Patients should always go to their primary care doctor at least once a year, at least for their annual wellness visit, just because at that visit they can go over important things like the current medications that they're taking, what conditions they have, ask if the conditions are stable or if there's any acute worsening, and then also go over healthcare maintenance, things like vaccinations and cancer screenings. But at the same time, patients should go to their primary care physician if they have any new acute complaints. Most commonly, we do see a lot of cold and cough, especially in the winter season. And then for other visits in terms of chronic disease management, we do see a lot of high blood pressure, diabetes, asthma, and we just make sure that the patient's symptoms are stable and making sure that they're up to date with their management. Primary care physicians have to really have the long game in mind. They have to really understand what their patients' goals are with their health. I am usually what I call their quarterback in the healthcare system, because the healthcare system is very complex. And I want to make sure that my patients are able to really understand what's going on with their health in all facets, whether that be nutrition, whether that be chronic disease management, whether that be speaking to their specialists about the various ailments that they may have. The great thing about working at Weill Cornell Medicine is that when I put in a referral to see a specialist, I can actually see the progress note that the specialist makes. And I can see what the specialist thinks is going on, what the treatment options are. And I'm really happy to be able to work with them because they provide world-class care. So it's really a lot of collaboration. And it's important for me to have these relationships with the specialist because it provides better patient care. I think the most important thing is that the physician really learns from the patient because we're able to learn from them the most. Different diseases may present differently in different people, and it's important for us to really speak to the patient, get to know what their story is, try and figure out a diagnosis plan and create a management plan. One of the most important things I can do for my patients is educate them about their condition. What that means is that when they step in, I listen to them intently, make sure that they're heard for, and I want to make sure that my patients are able to really understand what's going on with their health in all facets. And I just feel like that relationship is something to be cherished and something to be really, truly valued.
At Weill Cornell Medicine and New York Presbyterian, we really strive to deliver care that is collaborative, evidence-based, and care for a diverse population of patients, especially in Queens. We're always learning about our community. We're always striving to deliver the best possible care and reach out to our community. And so I think that's an important component of any doctor's office. It's inspiring to work here. It's inspiring to learn about different communities and cultures and families. I really look forward to learning about your child, and as your child grows, learning more and more about you and your family.
I entered pediatrics because I honestly felt like it was my calling. A lot of people, when I tell them I'm a pediatrician, they tell me, well, that makes a lot of sense. And they feel that it's just appropriate that I would obviously be working with small children. I don't find myself to be a very intimidating person. Children naturally like me, tend to come up to me and want to play with me. So I thought that it would probably be a good idea for me to be involved in pediatrics and also combine something that I really love too, which is science and medicine. It's so important to me that I establish a good rapport with my pediatric patients and that they have a really positive interaction with medicine and with me. So going forward, when they're seeing the doctor, whether it's me or somebody else, they know that they can trust the doctor. They know that going to the doctor isn't necessary. We might get things done that we don't necessarily want to get done, but ultimately it's all about their health care.
My number one job as a primary care provider is to make sure that patients are living the most meaningful life possible according to their own goals and their own wishes. That involves me getting to know them as a person It also involves me being a good listener and being flexible on how we treat each individual patient. It's very important that patients are, in order to have that relationship, educated and the most informed that they can be on their own medical issues, because we want them to be an active participator in their own medical care.